A healthcare industry is one of the most important aspects of a country's infrastructure. Having a weak healthcare industry is a serious problem, but this is very common in India. There have been many corruption scandals and ethical issues that have hindered hospitals from effectively treating patients. The proposed solution is for India's government to strengthen regulation and implement more policies regarding hospitals to solve some of the social and economic issues. One of the social issues is that doctors receive abuse daily from patients. Anxiety, long waiting periods, and crowded and unhygienic areas have caused patients' families to feel irritated and frustrated towards doctors. In addition, there's also a very strong social hierarchy in hospitals, where the junior doctor virtually has no freedom in expressing any of their opinions or ideas on any medical cases. Causes them to feel extremely frustrated, unhappy. Unhappiness stemming from the lack of freedom is shown in The Story of an Hour, where Miss Muller felt extremely unhappy while being married to her husband due to the severe lack of freedom that women had in the late 1800s. Many junior doctors have even considered dropping out of the occupation due to the unhappiness that they faced during work. To solve some of the social issues, India's government can make more hospital reforms, such as to lower rates of abuse, such as strengthen hospital security, having a proper complaint redressal system, and even ensuring there's enough doctors in each hospital. They can also make reforms to ensure that junior doctors are getting enough opportunities to learn and voice their opinions to grow. Through an economic lens, the issue is surrounding the income of doctors. Many private hospitals set a target for a doctor, meaning a doctor has to generate X amount of money to receive their income. According to Princeton University, individuals who make less than $75,000 a year have been associated with low emotional well-being and low life satisfaction. Many doctors in India do not make anywhere close to $75,000, causing them to feel extremely stressed and unhappy due to the absurd ways they have to generate their income. Now, this has a negative impact on hospitals, as individuals who are unhappy at their job cause financial strain on companies due to the lack of productivity. There is a limitation to more government regulation at this point. Many of these issues stem in private hospitals, where the owner of the hospital dictates how much money they have to pay each worker. However, they still have to follow government regulation. This is where the solution comes in. India's government can implement a law similar to the United States Fair Labor Standards Act, which allows workers to be paid fairly for the amount of hours they worked instead of how much money they generate. This can help workers not feel compelled to do unnecessary actions to generate money for their companies. And this can also raise healthcare workers' happiness and raise their productivity while in work. Thank you.